Hemophilia. Hemophilia is a hereditary bleeding disorder which arises in cases where the clotting factors 8, hemophilia A, and 9, hemophilia B or Christmas disease, are inadequate. Therefore, blood fails to clot properly. This implies that one might end up bleeding for a relatively long time after injury or surgical procedures. In normal cases, blood contains various proteins that make it easier for it to clot within a short period. Causes. Hemophilia is an inherited or genetic disorder that is passed to children by their parents. This disease is caused by a mutation on the genes located in the X chromosome, which hinders blood clotting from taking place properly. Females have 2 copies of genes in the X chromosome, while males have a single copy. This is because females inherit one X chromosome from their fathers and the other from their mothers, whereas males inherit the X chromosome from their mothers and the Y chromosome from their fathers. This means that the prevalence rate of hemophilia is higher in males than in females. The most common type of hemophilia is hemophilia A, which occurs due to deficiency of clotting factor 8. The other type of hemophilia is known as hemophilia B, and it is caused by deficiency of clotting factor 9, also called Christmas disease. Nevertheless, there is a high probability that an individual might suffer from acquired hemophilia, thus implying that the person did not inherit it from his parents. Examples of the conditions that are linked to acquired hemophilia include cancer, multiple sclerosis, pregnancy, and autoimmune conditions. Signs and symptoms. The major signs and symptoms of hemophilia include excessive bleeding after getting injured or undergoing a surgery, unexplained bleeding after getting vaccinations, pain and swelling of joints, hips, knees, ankles, elbows, tightness, and decreased range of motion, deep and large bruises on the skin, blood in urine, hematuria, blood in stool, tarry stool, frequent nosebleeds that do not stop with ease. The key symptoms that can be used to denote that an infant is suffering from hemophilia include excessive bleeding in an infant's mouth after minor injuries that might be caused by toys, a high rate of irritability, fussiness, and refusal to walk or crawl, which might be associated with muscle or joint pains caused by internal bleeding in such areas, hematomas or masses of congealed blood that occur under the infant's skin. Diagnostic interventions. In most cases, individuals who suffer from hemophilia are diagnosed during the first year of their lives. This is because children who are born in families that have a history of hemophilia are tested immediately after birth in order to ascertain whether they might be affected. The essence of such an undertaking is to enable the parents to get adequate insight on how to manage the disease with ease, for instance, ensuring that the infant gets adequate medical care now and then. During the diagnosis process, a blood test is conducted in order to assess whether the patient's blood might be clotting properly. CBC with a manual differential can confirm the diagnosis of thrombocytopenia. A blood smear is used to determine the morphology of platelets. After that, a factor assay test, blood clotting factor test, will be done in order to identify the key cause of the bleeding disorder. This insight is used as an effective basis of denoting the type of hemophilia a patient might be suffering from and its severity. Treatment options. One of the treatment strategies used to enhance patients with hemophilia to recover is replacing the blood clotting factor that might be missing in their blood. This objective can be achieved by infusing the blood clotting factor through a vein, thus leading to a case whereby blood would begin to clot properly. In fact, it is recommended for patients with hemophilia to be trained on how to conduct the infusions while at their homes. This means that they can easily manage the disease without the need to visit the hospital now and then. The recommended blood clotting factor for treatment of hemophilia A is factor 8 concentrates, while for hemophilia B, factor 9 concentrates is used for the treatment. Prompt treatment with clotting factors have shown to minimize the complications caused by bleeding, such as joint deformities. Nursing interventions for a patient with hemophilia. Some of the nursing interventions that are recommended for patients with hemophilia include procedures such as intramuscular injections, arterial sticks, and peripheral blood draws should be avoided or kept to a minimum. Avoid range of motion on the swelling joints. Patient teaching. Patient education and health promotion are some of the key strategies that can be adopted to enhance a patient manage the ailment with ease. Examples of the issues that might be considered in this case include teaching the patients how to conduct prophylaxis, which means that they should be in a position to infuse themselves with the blood clotting factor, FIX product, without the need to pay a visit to the hospital. Teaching the patient about the appropriate nutritional programs they should adopt, key among them being consuming foods that are rich in iron, folate, and vitamin B12, recommending the appropriate supplements that the patient should take, such as folate and iron supplements. Teach patient to avoid the use of aspirin. Teach patient to use soft toothbrush. Encourage the use of electric razor for shaving. Do not blow nose. If laceration occurs, apply direct pressure to the site until bleeding stops. Patient should contact the doctor for any injury. Encourage patient to wear medical alert identification, nursing diagnosis for hemophilia. Include risk for injury, risk for bleeding, acute pain. Thanks very much for watching. If you like this video, please do not forget to subscribe, share, like, and click the bell icon for more educational videos like this. Until then, please have a great day.